Around the world, COVID-19 has impacted the most vulnerable. Since the outbreak of the virus, millions have lost their jobs and livelihoods. In Central America alone, the impacts of COVID-19 and extreme climate events has seen the number of people living in hunger rise from 2.2 million to 8 million.
Pues a veces, si solo hay para ellos, solo para ellos. Usted sabe que uno de padre prefiere que los hijos coman que uno.
The highest level of negative impact is on the poorest communities and the wage earners, migrants, and also tribal communities who do not have enough of their own production or surplus.
The pandemic has left the vulnerable areas at much greater risk from future disasters.
Pues antes de que empezara la pandemia nosotros teníamos trabajo, pero cuando la pandemia entonces todo se cerró, ya no los dejaban ni salir, empezó los toques de queda, ya no, nadie podía salir de su casa, entonces ya no podíamos trabajar ni para poder traer los alimentos a la casa. De ahí que se vinieron los huracanes, a veces nos enfermaban los niños y sin ni un peso, y por eso habíamos decidido irlo, porque queríamos terminar la casa, comprarle algo mejor a los niños, comprarles camas, tener un buen trabajo, pues una vida diferente.
COVID-19 has provided the world with a unique opportunity to realign our systems towards social, economic, and environmental sustainability. We must fight systemic risk with a systemic approach. COVID-19 has demonstrated we must have a coordinated approach to reducing risk across borders, leveraging the capacities of all relevant line ministries, including national disaster risk management agencies. The scale of the disaster requires new ways of working and innovative partnerships. The voices of those most affected must be heard in order to address their specific needs. We must map risk from many angles and work in a collaborative, transboundary way. We have the opportunity to build resilience into COVID-19 recovery plans, so the world is ready to face the greatest challenge of the climate crisis that we know is still to come.
Good morning, everybody, and a warm welcome to all of you. This session title is The Learning from COVID-19, Social and Economic Recovery for All. In other words, how do we learn to live although COVID is still here and we see it every day for all of us being here? With more than 500 million confirmed cases and over 6 million confirmed deaths. And for example, in the US, they just have like the 1 million deaths confirmed. The COVID-19 pandemic has exposed the vulnerability and inequities in our society and associated system, and has severely challenged our progress toward the SDG. Since the beginning, the multiple cascading social and economic impact of the pandemic, along with the measure to contain the spread of the disease, has been far more than a health crisis, affecting entire society and economic and exposing the vulnerability of all national social protection systems the world over. Exacerbated, as we just saw in the video, by climate-related and other simultaneous diseases and disaster events, the pandemic has irrefutably worsened already existing inequities. vulnerabilities, discriminatories, treatment, and fragile contexts. These complex crises also highlight the need for better understanding and management of risk through informed governance. Today, what we want to discuss, although we're still in the COVID, like all of us have masks or have had to be tested, we just want to make sure that how do we start learning and change the system. From those joining the session, questions can be made to today's panelists through a question and answer in the Slido function, through the virtual event platform. Given the limited time we have, I'll encourage all of you to start, as the speaker goes and explain and discuss, to start putting questions around so that we'll be having enough questions for the speakers. And please also include your full name, organization, as well as your email address so that we can revert back with response in the case we are unable to address your question during the session. Our first intervention is from Mike Ryan, Executive Director of World Health Assembly Organization Health Emergency Program. Actually, I'm just coming back from Geneva, where there's a World Health Assembly, and we have a conversation about it. Dr. Mike Ryan has been at the forefront of managing acute risk to global health for nearly 25 years. He also served as WHO's Assistant Director General for Emergency Preparedness and Response, and has worked in conflict-affected countries and led many responses to high-impact epidemics. He's a founding member of the Global Outbreak Alert and Response Network, GOAN, which has helped aid the response to hundreds of diseases outbreak around the world. My connection with him, actually, I was one of the first group trained on the Gohan epidemic. He also served as coordinator of epidemic response, operation coordinator of WHO response to the SARS outbreak, and WHO director for global alert response. He's completed his training in the blend, and I think we can always look. Mike is a really well advanced person. And with this, we'll have, because it's the World Health Assembly week, and he have to be in Geneva, he could not be here, but we'll have the honor to have his video. Thank you.
Excellencies, dear colleagues and friends, I am delighted to join you today for this high-level dialogue on learning from COVID-19, social and economic recovery for all. I wish to extend my apologies that I am unable to join you in person due to my commitments here at the World Health Assembly, which is being held in Geneva. WHO member states, partner organisations and the WHO Secretariat are not only discussing how to bring this pandemic to an end as soon as possible, but we're also reflecting on the lessons, challenges and progress and charting future directions for our joint efforts to reduce the health risks and consequences of all types of health emergencies. These include strengthening of the International Health Regulations 2005, the negotiation of a new international instrument for pandemic prevention and preparedness and response, and continuing support for strengthening resilience of countries and communities. Our attention is not just focused on the current COVID-19 pandemic, because communities and countries around the world have been experiencing devastating concurrent emergencies during the pandemic. In addition, risks continue to be created by climate change, food insecurity and the lack of access to even the most basic services, such as drinking water and healthcare. These are systemic risks that require, first, a very good understanding of risk, second, effective risk governance, third, investment in resilience, and fourth, enhanced preparedness and building back better in recovery, rehabilitation and reconstruction. You may recognise these points. They are in fact the 4 priorities for action in the Sendai Framework for Disaster Risk Reduction 2015 to 2030. It is important to remember that the world is still in a pandemic, and yet there are many issues and inequities that need to be addressed, such as the removal of obstacles to equitable access to vaccines, diagnostics and treatments for all people. Mental health issues have been exacerbated by the grief of losing family members and close friends who have died due to COVID-19, the effects of quarantine and isolation on social and family relationships, and the loss of livelihoods. Clearly, people will need to be supported for many months and years to come. Second, health workers alongside other frontline workers have been affected greatly. Many have died and many more have been infected. Many health workers have decided to leave the profession due to the stress, fatigue and lack of support they have experienced. The impacts of COVID-19 on the health workforce will be felt for many years to come. People are also suffering from delays to much-needed treatment and diagnostics for non-COVID conditions such as cancer screening. The restoration of essential health services and the recovery of these services in communities most affected by COVID-19 will be a long-term process. I mention this because there is a long tail to COVID-19 which will continue to affect individual and community recovery into the future. People have been faced with other major challenges to their health and well-being, including concurrent emergencies such as conflict and community violence, other disease outbreak, disasters, and the influence of climate change. All of these factors point to the systemic nature of risk, which requires systemic solutions involving all sectors and people working together through a whole-of-society action. It is important to review lessons from the entire experience of COVID-19, not just the recent months when the focus has been on the equitable distribution of vaccines and treatments. Effective governments and leadership have been critical throughout the pandemic. The scale and impact of COVID-19 has necessitated the strengthening of existing and new mechanisms and a high level of collaboration between health and other sectors in many countries and across borders. We need to ensure that this high level of collaboration and the relationships are sustained into the future. We also need to ensure that the effective leadership and coordination mechanisms are employed effectively and sustained for prevention, preparedness and recovery, not just for this response. WHO has called on leaders and policymakers within health, finance and other sectors to leverage the good practices from COVID-19, to strengthen pandemic preparedness and readiness, and to increase domestic and global investment in the foundations of health systems and all hazards emergency risk management. The risk management approach in the Sendai framework and the WHO Health Emergency and Disaster Risk Management Framework form the basis of a common approach within and across all sectors. A risk management approach founded on an understanding of vulnerabilities and capacities in the community also gives priority to understanding and addressing the pre-existing inequities and disproportionate impact of COVID-19 on marginalised and vulnerable groups. These mechanisms, which have been vital for whole-of-society collaboration, must be institutionalised, with all stakeholders engaged and respected for their roles and contributions. In conclusion, there have been many lessons identified in COVID-19. We are indeed at a point where verbal commitments to lessons learned must be translated into actions that transform governance and are supported by the resources and the necessary investments. As many people who have experienced emergencies and disasters know only too well, their world and their lives are transformed profoundly by these experiences. There is no doubt that COVID-19 has transformed our world and the lives of people all over this planet. People are resilient, not only vulnerable. I am convinced from what I have seen that people have the solutions. We have many lessons, but all actors led by governments must have choices to make. We need to turn in the direction away from decisions that increase the risk for people and towards the actions that enable people to thrive and enjoy the highest standards of health, well-being and the best quality of life. At all levels, the only way forward is working together. There are no other options.
Thank you. I think this is really clear message about COVID starts with a health crisis, but become a whole system crisis. And we have to, for this system, we have to work as a one communities. And with this, I just wanted to welcome our panelists today. We have a really good, diverse, and high and interesting panelists. A warm welcome to Mr. Jagan, who is working with the Secretary General of International Federation of Red Cross, the Honorable Minister, Bill Blair, who is the president of the Queen's Private Council for Canada and Ministry of Emergency Preparedness for the Government of Canada. The Honorable Mrs. Timbisile, the Deputy Minister of Cooperation, Governance and Traditional Affairs of South Africa. And the last but not the least, Mrs. Patima Gohan, who is the President of the National Indigenous Disabled Women Association, Nepal. First round, we'll have some defined question for the different panelists, and I will encourage them to actually keep to the time so that we'll have more question follow-up. My first one, I will now move to the first person in the speakers, Mr. Jagan, who is the Secretary General of International Federation of Red Cross since February 2020, just at the beginning of COVID. That will be really interesting to hear your perspective from that way. And he's based in Geneva, Switzerland. He began his career as a youth volunteer with the Nepal Red Cross, representing and advocating for communities. An engineer by training, he has spent more than 25 years working across Europe and Asia for the IFRC, where he also previously served as Under Secretary General for Program and Operation, guiding relief and development efforts around the world, as well as Chief of Staff and Director of the Asia-Pacific region. Mr. Jagan, considering the complexity we face and the effect of the COVID-19 pandemic on different coexisting groups, sector and system, how can government and stakeholders better identify and manage current and emerging systemic risks, including climate crisis? Over to you. Thank you.
Thank you. Thank you so much, and thank you for having me on this very important panel. Let me try to focus on just a couple of things here, because if we try to look into these issues, 5 minutes is not going to be possible. One of the very important lessons learned out of the COVID-19 and, of course, the ongoing climate crisis is that we have to focus on the underlying causes, not only on the symptoms. A lot of times we are trying to find solutions to the symptoms and ignore the underlying causes, which actually exacerbate the real situation here. As we saw during COVID-19, one of the major factors of the underlying causes was the factor of inequity. We saw inequity among nations. Right now, I come from Switzerland. There is zero restrictions on COVID-19. No need to wear masks like we are doing here. No need to test, as we have to do it here. We have countries with surplus vaccines, and we have still the vaccination rate in Africa, which is hovering around 15% and 16% on average. We see this massive inequity among nations. And we saw a massive inequity within nations. The availability of the PPEs, or the availability of vaccines, availability of services differ within the countries. The capitals and the people which had influence got access first. Not the people who actually needed. So it was not need-based. It was influence-based. So we saw that massive inequity. And third inequity we saw was in the communities itself. We saw some of the responses in some countries, not in every country, that the vulnerable and the marginalized communities were excluded. The refugees, migrants, the people living in the slums were not prioritized. That was not very smart. The virus would not differentiate whether you are migrants or refugees. They don't check your visas. They don't check your migration status. And you can easily transmit the virus to others, even if you are migrants, if you are refugees. So we saw this a very high level of inequities. We saw the inequities of development. We saw the inequities on the healthcare systems. So I think we really need to take inequity very seriously. And it's not only for COVID-19, but it's also for climate-related issues here. So I would like to highlight that there are few things that we need to put in place. We need to have a strong international and domestic laws and systems that help put foundations to address the inequities. That is absolutely important. And the second aspect is the investing at the community level, particularly, of course, if we are talking about the COVID-19, is on the health systems, not only for response, but also at the community level preparedness. And I'm sure Minister Bill Blair will talk about it. I saw the response in Canada and the lessons you learned very quickly to invest actually on preparedness. And I know the Canadian Red Cross played a very important role on that, and this needs to happen everywhere. So having a legal system, right legal system, domestically, internationally, and investing at the community level is critical. The second aspect I would like to share with you is absolutely mainstreaming the anticipatory action. We must be able to anticipate better. The health crisis, the pandemics, we must be able to anticipate better. There is enough science there. There is enough information. But because we haven't been investing sufficiently on the community-based surveillance systems, a lot of time the information doesn't reach the decision maker in a timely manner. So it is very important to invest at the community-level surveillance system for health-related issues, but also for other issues like the climate, the preparedness at the community level, resilience that we have been talking about. And this preparedness has to be coupled with the predictable financing and of financing at a scale that is required. A lot of times we are very happy to invest billions after the crisis has happened, but we are not willing to spend millions before the crisis happens, to prepare for, to have that capacity to respond. So I think those two aspects I want to share here address the root causes, particularly of inequity, and invest our capacity to anticipate and respond and have that predictable financing at the scale so that we can hopefully be better prepared for the crisis in the future. Over to you, Valerie.
Thank you. As you raised, this is a good part of raising for the panel today. Inequity, we saw it. It was really evident, but also the community level preparedness. And what we saw in COVID is how we thought by closing doors, closing things, and we didn't realize that unless everybody is safe, nobody is safe. And I think we learned from that. But also, preparedness has been a difficult thing for funding. How do we learn from there? How do we make initial advance to prepare and to fund sustainable funding? I think that will be a critical way for us to move forward. Thank you so much for initiating the conversation. Now, I will just want to turn to Minister Blair. He mentioned about the Canada experience. He mentioned about sustainable part of the G7, sustainable funding, financing. The Honorable Minister Blair was first elected as Member of Parliament from Scarborough Southern in 2015. He previously served as Ministry of Public Safety and Emergency Preparedness and as Ministry of Border Security and Organized Crime Reduction, as well as 39 years with the Toronto Police Services. The last 10 has been as Chief of Police. I guess you start at 10 years old, maybe?
Yes, ma'am.
Thank you. Minister Blair has demonstrated his ability to unite and engage others through his numerous roles in provincial, national, and international policy forum, and is dedicated to many social causes, having worked with some of the Toronto most respected organizations, such as Covenant House, the United Way, and the Children's Aid Society of Toronto. He also served on the board of directors of the former Scarborough Hospital Foundation, and he was vice patron of the Good Neighborhood Club, a day center for elderly homeless men, and also served as president of both the Ontario and Canadian Association of Chiefs of Police, receiving numerous distinctions. What you didn't do, oh my goodness, I think you still have a lot to do. But to come back to our session, Minister Blair, what are the key elements identified from the pandemic experience that can help us strengthen disaster risk governance and build stronger and more forward-looking, innovative and transformation systems for managing all types of hazard and risk? And because I think we saw how Canada have been able to contain for some time, but also to engage. Please, Minister.
Well, thank you very much, and thank you for the kind introduction. It's a great honor to be at this disaster risk reduction global platform, but also to be at this table with so many distinguished guests. And I'm looking forward to our conversation this morning. You know, it was actually quite interesting that we began with Dr. Ryan from the WHO, because I remember most vividly in March of 2020, Dr. Ryan was giving a speech, and one of the things governments around the world to do was to go fast. And I will tell you, I think it was the best advice that we received at the outset of the pandemic. He said, don't wait for all the information. Don't wait for all of the advice. Do what is necessary and do it quickly. And we took that advice, and I think most of us did. And I take the opportunity, he's not here, but to express my gratitude, because I think it was really important on how we began. One of the things that I would make an observation about the way in which we responded right around the world. Among the very first things we did, and I think it's important to acknowledge that we were not well prepared for the pandemic. Notwithstanding our experience with other health-related events, no one was prepared fully for this pandemic. But one of the first things we did was we began to build in border restrictions and limit the movement of people between our countries. And I think we see that the interconnectedness of our worlds is a double-edged sword. It's how the virus spreads. But one of the things that we learned, and I wanted to ensure that I shared, was that we learned throughout the course of this pandemic that it's only by working together that we've been successful in mitigating its effects through vaccine treatments, through various health measures, and global support. And I think it's important that we recognize no country can be safe unless all countries can be safe. And that's why working together is so important. I also wanted to make the observation as well that disasters like the pandemic create a vicious cycle that reinforces inequalities, that groups that are disadvantaged, who are disadvantaged already, suffer disproportionately from these disasters. And so we see vulnerable groups, and in our country that would be our indigenous population, the disabled, women and girls, the elderly, and those who live in poverty. And I think it's very important that we not only focus on their vulnerability, but that we also work with them and listen to them. Because there is, I think, wisdom within those groups, and to ensure that all of those particularly vulnerable groups are included in our planning and in our response. I also wanted to share, if I may, one of the things we recognize is the impact of the pandemic. The health impacts were quite significant, and I think others can very ably we did, but we also recognized that there would be very significant economic and social impacts of the pandemic. There was a significant reduction in our GDP. There was literally millions of people put out of work almost immediately, disruption to essential supply chains. And so our government actually began to make significant investments in providing support to our citizens to ensure that there would be food on the table and a roof over their heads. We've provided support to small business. And our effort was to mitigate the devastating economic and social impacts on individuals and on our national economy, to limit the damage of the pandemic. And I would share with you that those investments, they were not only morally right, but I think they were a good business practice, because I think it has put us in a good position to recover more rapidly from the devastating impact of the pandemic. And the last thing I would like to quickly share, and it is in response to our friends from the International Red Cross. One of the lessons that we learned and have applied very effectively is engaging appropriately with civil society, the NGOs in our society. One of the first challenges we faced was the significant impact of the pandemic in our long-term care facilities, where seniors live in a congregate setting and receive treatment. But the pandemic was particularly deadly in those environments. We were asked for help from the healthcare providers, and our first response, quite frankly, was to send in the military. We sent soldiers, but the soldiers were not the right response. And it was only by reaching out to the Canadian Red Cross and engaging with them in the creation of what we could have termed a humanitarian workforce, to build capacity within the NGOs so that we could draw upon them and to leverage the incredible power of citizens and volunteers. The expertise of the NGOs and their engagement with our citizens has really put us in a much stronger position in order to respond not only to the pandemic, but to future disasters. And I think it's an excellent model for response. I'll conclude there, and thank you for the opportunity to speak.
Thank you, Minister Blair. I think you mentioned something really important in your remark, is that it's only by working together that we can make it. And And the COVID showed us that vicious circle where it's linked with economic recovery, people don't have jobs, then they can eat, and then all the whole society approach is only the only way. But also, all sectors are important, especially the civil society in the response. But coming back to that, because your country is a rich country, and I have to say that, because then you can pay the people giving that. And it has not been the same in a lot of countries who can give social funding to business, or in Africa where we have a big informal sector, especially women who are in the formal sector. We saw some countries, 70% that are not even registered. And we need to actually look at how do we support that, and how do we support the indigenous, the company. And I think we'll come back to that, because this is really, as Jagan mentioned, the inequities that was just highlighted, and we need to do better as the way we work together. Then, with that, I think I'll turn to Honorable Minister Dembi to actually get a perspective. We heard from Canada, and then we'll get back to the LMIC. Mrs. Dembi is the Deputy Minister of Cooperation, Cooperative Governance and Traditional Affairs in South Africa. She was previously president of the South African Local Government Association, SALGA, co-president of the United City of Local Government, and the executive mayor of Polokwane municipality in Limpopo province. In addition to managerial positions in both public administration and in the private sector, Mrs. Nkadimen has also held various leadership position in the structure of her political party, the current ruling party, the African National Congress, ANC, of Mr. Mandela. Mrs. Nkadimen holds a Bachelor of Arts and Philosophy from the University of Stellenbosch. Question for you. We just heard from IFRC, we heard from the Minister Blair about the situation in the high country, and we know South Africa, if we look at the continent of Africa, have also suffered a lot from COVID. Same question to you. What are the key elements identified from the pandemic experience that can help us strengthen disaster risk governance and build stronger and more forward-looking, innovative and transformative systems for managing all types of hazard and risk? And what is your perspective actually from a low-medium income country, and how South Africa manage it? Thank you.
Thank you very much, Valerie, and good morning to my fellow panelist members as well. Look, closer to my mic, better. Thank you. I think the experience of South Africa, 750 days into the risk management of the pandemic, the president actually, just not so long ago, 4th April, terminated the state of disaster, which was managing COVID-19 in South Africa. The first learning key was the appreciation of our indigenous systems. Much as we had the law, the legislation, the act to manage disaster, we also had various experiences from people on how to manage themselves and diseases that have been learned before. And we realized that without the partnership with traditional leaders, for example, the elders in society, to bringing out more of the indigenous system, particularly in the rural areas, where there isn't quite a lot of basic health infrastructure, where to find replacement by going back to the old and how people were living. But secondly, the legislation itself, much as it has been enacted before, actually to be precise, in 2002, the Disaster Management Act in South Africa was reviewed, adopted by Parliament and packed. We had never experienced a pandemic or to put the Disaster Act since 2002 into practice. Wow, we sat with quite a lot of legal challenges from political parties, from civil society, from religious organizations. It was like you are taking our freedom away from us, and we're not used to this. The good part of it was we were able to defend legally the existence and the legitimate right of the Act, while opening the door. Our president led many engagements with these various, whether it's the religious, will go to court, win, but bring them into the House to explain the importance. And that led to various institutional arrangements, allowing them to have their input, of course, which is not in contradiction with what the X would want to do. So it forced us into some adaptive form of governance. We had political structures which are led by ourselves in the ministry, cabinet, but we also had institutional, which are management, but then civil society had an open engagement with government to ensure that our system of government also involved them in this risk management. Participation and collaboration with other institutions was also helpful to create a holistic and an integrated approach, so that we are able to assess the risks, but also we become we create unified responses and ensure that the incidents that we are managing that comes out of COVID are better managed. But as my colleague said, disaster enforces inequalities. He spoke at much length about inequalities of other countries from the basis of influence and access to resources. But you also find that institutionalized in your countries as well. You have the legal resources, but which are only accessible to the rich and not to the far-flung in your rural areas, of which South Africa, for example, as a developmental country, still in its infancy of growth, there's quite a large number of people who are destitute. And it will be difficult for them, one, to reach a hospital because of poor infrastructure, two, to find a bed in that hospital if they're able to reach it, but three, to have access equally to the very same amenities that are needed. And you find that it is easier for the rich person to get immunized because he has a medical aid, and the poor to go and queue for a vaccine that is not necessarily available. As she reaches the door, the last batch of the vaccine got finished the day before. And it will still be another scramble to get a delivery batch. And we'll go to the airport and celebrate a delivery of a vaccine, 40,000 packs, and you're like, we're 50 million. Who will I start with and how will I will end? But anticipatory governance was also what was key for us to harness the collectiveness of what we need to be able to do. And I think that's what we needed to harmonize. But I've seen also for the first time the fourth industrial revolution being integrated truly so in our governance system. For the first time, my council meeting was held online. We have always been sitting physically, all of us, and had never thought there will be any other way of running a country while sitting at home. But COVID did force us to do that. Thank you very much. I think let me stop here for now.
Thank you very much, Honorable Minister. I think you raised different points here. The first one is still the indigenous system. I think we have to learn to use what is existing, and all the system, the informal system, the traditional leaders are really a key. But I think one of the more lessons we see everywhere, the legislation, the law. A lot of the time we have so beautiful theory, paper, legislation, but we don't put in action. I think COVID-19 showed us that we need to move from law to action, but we need to have a whole society approach in how we look at that, and we need to make sure that we bring everybody, because the inequity will make all of us at risk. And how do we look at that? And the more important, I think, one thing we learned in South Africa, the participation and the collaboration, because we saw, even if it was not something putting in place, but it ended up being something that came out. The scientific community were actually brought in, and South Africa have shown how we also learned a lot of data. There was the first one with Omicron, there was actually the scientific also, and how do we link on that? And I think you said something really, access to simple things as bed, PPR, vaccine, is still a lot of issues in a lot of communities. But one thing that we all learned from COVID-19 is that any crisis provides us with opportunities. Like be able to have this conference with virtual and in presence. And it gave me an opportunity to say, welcome to everybody who is on the screen now, listening. This is actually the progress that we learned. One of the lessons learned from COVID, that is not actually that bad. We can actually work differently. Thank you again for this remark. And then this is a good opportunity for me to move to Patima. Mrs. Patima Gohan is the president of the National Indigenous Disabled Women Association in Nepal, the general secretary of the Indigenous Person with Disability Global Network, as well as board member at Women Enable International. An academic activist from Nepal, she has been remarkable in bridging multiple marginalized identity, initiating cross-movement collaboration with intersectional lenses amongst women, indigeneity, disabled, and other marginalized movements and discourse, as well as in raising the voice of youth, young indigenous people, women with disability from Nepal, Asia, and globally since 2011. She's also a faculty member in Patima College, one of the single women colleges in Nepal, and of the McGill University in Canada, and also contributing as an expert on the Disability National Direction Committee under the Ministry of Women, Children, and Senior Citizens of the Government of Nepal. She has been working in environment justice and disaster risk reduction issues since 2015, focusing on the marginalized group on the ground. Mrs. Goring, you heard the inequity and how it's affecting a lot of showing the vulnerability, but also the marginalized and the indigenous population. And the good thing is that you are here to have that voice and to help us. From you on this, but from your point of view, what is the impact of the situation from COVID-19 pandemic on most marginalized groups, such as women, indigenous women, persons with disability, and others? And what are the key lessons learned working for marginalized groups? Over to you.
Thank you, Madam Chair, and I am very much honored to be here in this panel representing on behalf of the CSOs and the most marginalized groups like women, indigenous people, and people with disabilities, including other marginalized groups. We know that the COVID pandemic has created unprecedented crisis for government and the overall citizen, including marginalized people. When we see from these perspectives, I would also like to highlight that the most marginalized groups engaged in the informal sectors for their basic livelihoods were the ones who were obliged to lose their source of income. And consequently, they have been pushed into the extreme poverty. And this has really posed a question to us. When we are achieving sustainable development goals, relating with leaving no one behind. So it has really created an disproportionate and inequalities among these groups. And when I talk about the most marginalized groups like women, indigenous people, persons with disabilities, sex workers, homelessness, migrant, LGBTIQ communities, they have faced very distinct realities And those realities are not common with other people. This is what I would say. When it comes to the accessing healthcare, support services, lack of information, enabling safe spaces, and sensitivity was the major crux that we face. When it comes to persons with disabilities and indigenous people, there was serious stigma and attitudinal discriminations, and that is why they remained isolation. The increased rate of psychological and psychosocial stress and anxiety increased in their lives during the pandemic. And this is distinct than other forms of disasters. If you look at the data from my country, Nepal, it says near about 91% women with disabilities, including indigenous women with disabilities, faced violence, abuse, and sex during the pandemic. And 86.5% marginalized groups, including persons with disabilities and indigenous peoples, lost their livelihood. So this data is really very acute. If you look at in terms of particular vulnerable group, I would say that the social distancing measures, frequent hand washing system with adequate wash system, inaccessible quarantine, confining within the homes, lack of inaccessible informations, particularly to deaf people, people with psychosocial and intellectual disability, indigenous peoples who are not able to understand the major language of the country. So this has really been a turmoil situation to this particular group. The response and the recovery measures were in a blanket approach without effective and efficient preparedness, without any consultations of their distinct needs of the marginalized groups. And we also realized that there was a lack of coordinated mechanism from the respective organization, including the government and the other stakeholders. So for me, I would also see that the COVID interventions was framed in a very siloed approach, related only with the health measures, not concerned with the DRR. So for me, I would also say that the government commitment and the will matter a lot when it comes to addressing the most marginalized groups because of the specific needs that they require during the crisis, and it might be the COVID crisis. So I would say that the systematic risks and the vulnerability mapping system, the disaster preparedness and the targeted interventions was not part of the COVID response and recovery. And that is why we still find that many people are left behind. One of the things that I wanted to highlight about the key lesson learned is about the meaningful participation of the most marginalized groups in the entire process of the preparedness, recovery, and reconstructions to build back better and to ensure that no one leaving behind is crucial. We have also evident and known that one size fits all has not worked. That is why we are looking for an intersectional, multi-stakeholder engagement from all the stakeholders. And we also see that the traditional knowledge, the cosmovision of indigenous peoples, the skills and the practices that they hold and they practice during the COVID pandemic has really been a great practices. So I think we have to continue those indigenous knowledge and practices relating with disasters, emergency management, and response recovery. Thank you.
Thank you. This is beautiful because I think you raise really important points here. One of them is that we, as the UN put the SDG, we saw that one of the things is leave no one behind. But the COVID pandemic actually have put a lot of the SDG on the hold, and some of them we actually degraded with COVID and may not make the SDG 2030 if we are not retaken from that perspective. And something like simple as access to information was critical, and I think the one size fits all, because we actually communicate when it didn't work. And we have to look at it, how do we look at it differently? Like you mentioned, the informal sector, that unfortunately is usually the inequity and the people, the extreme poverty. With people losing their job, we saw how devastating it was. And the video we saw at the beginning of the thing show how people have to stop eating or reduce the food consumption because they did it, the schooling, etc. And the access to bed, as the Minister Temzi said earlier. And I think this is where the violence in all the places and more even with extreme poverty just came even bigger. And I want to take you on that, Patima, as we really go back. You get a lot of issues that we face, and you saw like how we look at it. From your perspective, what are some of the concrete action and way forward moving the transforming social and economic recovery for marginalized groups, ensuring an inclusive world for all? Because how are we recovering for this? And how we can make all of us a better world for tomorrow? Over to you.
Thank you, madam. So it clearly shows that the COVID will last for another couple of years. Therefore, it's very imperative to take concrete, tangible actions by ensuring the inclusive world, which requires a long-term preparedness, mass awareness, and this is where the CSO's roles are very crucial. We are looking also for a multi-pronged approach from the government. And when we say multi-pronged approach, we are also looking at the targeted interventions and formats. For example, the government can set, just to give you an example, the early warning systems and evacuation system for most marginalized groups. So these are the kind of things that can be done for the most marginalized groups. But at the same time, I would also like to highlight about the collective teamwork is very much crucial for enabling the safe and resilient environment for the marginalized groups. This means that the role of leadership of the CSOs, the role of people with disabilities, the role of indigenous peoples related with their traditional knowledge and systems is very much crucial in the entire process. We also have been hearing in this conversation that most often marginalized groups are always quote unquote put into a vulnerable group. But I would like to admit that we are not vulnerable all the time. We are contributing to the family, to the society, and to the country that we live and we can. So I think during the disasters also this message to convey that vulnerable groups are not passive, they are active recipients and they can act is very much fundamental. We also are looking for the system-wide action approach. And when we say system-wide action approach, some of the discriminatory practices that happened during the disasters, during the COVID pandemic is very much crucial. And this is where the CSO's mobilizations are very much crucial to have a consolidated understanding on the impact of climate change, disasters, and the Sendai framework within all stakeholders. The DRR process is very much crucial, and for that, I would also request for allocating sufficient and enhanced resources and funding to implement the commitment into actions at the local and national level, which is very much crucial. Thank you.
Thank you, Patima. I think you raise a good point here. We have to look at the people. It's not because, like usually say, it's not because they don't have a big bank account, or they are not just the poor as receiving, they are actually an active part of our society. And we saw it when things closed, we couldn't eat, we couldn't find things because they are active part, and we have to stop them, see as a recipient, but as a part of it. And I think you raised something really important. How do we looking at the preparedness and respond? How do we build back better? And we can only do that if you have a multiple approach. And more important, when we put system as early warning system, how do we make sure that it reaches the people from any different type of the society. If not, it's not a good system. We cannot build stronger or better if we don't reach for this inequity. And I think this one brings me to Minister Tembi. I think, how can we do better for the risk ahead? How can we build a better managed risk in the future?
Well, I think for me, it's what Minister Blair had said. One, it's cooperation, which moves beyond the talk language. You know, to leave no one behind. It's easy to say, but it meets its greatest test in its implementation. But it's also to be able to utilize each and everybody within a society to be able to play a contributory role in prevention. Yes, some disasters you can't prevent. You better be more prepared for them to be able to have responsive and risk reduction strategies. But if they don't involve the people themselves and driven by them owning the process, then we will never be able to say, leave no one behind. But by collaboration, I mean, we need to move beyond the talking now, the implementation, and peer review. What could we learn? For example, in South Africa, Minister Blair may not know, we have a partnership with the Federation of Canadian Municipalities and an exchange program with our Eastern Cape Rural Province of South Africa. In that way, it's pairing a country that is a bit advanced, has got systems, with a learning country that is still trying to develop this, so that you don't reinvent the wheel. What has been done somewhere, you can be able to customize it to your locality, to be appropriate, to be manageable in the usual chunks, and how you disseminate information while implementing at a faster pace. And I think it's high time that we really make such gatherings more meaningful than coming together to talk and not implement. But I think funding initiatives are key. But what we often do, we throw money into the problem. We don't solve the problem itself. And unfortunately, those who don't have money sometimes don't even have anything to throw around, and they remain looking around on what they could be able to do. But even when aid comes, it finds less or little resourced countries with very little on the platform and on the page on what they need to do. But lastly, for me, will be changing the behavior of citizens. I mean, we are going through the floods in KwaZulu-Natal, second time around in 2 weeks. First time around, we had the early warning. We were not very much ready. We lost almost 500 people. Second time around in the following week, at the emergency and the early warning, we were able to evacuate over 400 families in a night. So that shows that preparedness is the answer to risk reduction.
Thank you, Minister Tembi. I think you raised cooperation, no one behind, but the funding. And it's not just about how much money, it's how the money is implemented, and it's how we put at it in the way that it serves everybody and actually bring that preparedness in action. And I think this, you mentioned the partnership with Canada, but you also mentioned the funding. And Minister Blair, you mentioned earlier, how do we look at it? And I think I'll turn to you as well. What are your thoughts on it? And how can we better manage risk in the future?
Thank you very much. I wanted to respond to some of the comments that have been made. I think it's very clear. One of the things we did learn from the pandemic is that poverty and vulnerability actually increases disaster risk, but disasters increase poverty. And we've seen the impact of this pandemic. We can count the number of people that have been hospitalized and the people that we have lost to the pandemic. But the damage is not over. And what we have seen is it has not been an equitable distribution of harm across the globe. And so it's very clear. We've seen the enormous impacts on economies. We've seen a significant increase in violence against women in all of our societies. We've seen really the vulnerabilities that the pandemic lays bare. And I think it does require that we start to think about how we better prepare. And I agree that a dollar invested in prevention and mitigation will save $10 in recovery. And so I think that's a challenge to us. And it would lead me to one other observation. We often talk about the cost of rebuilding and building back better, and that is incumbent upon us. But I think we need to change the conversation, and we need to begin to talk about what it will save. Not just what it will cost, but what it will save in terms of lives, in terms of future prosperity right across the globe. And much of this conference has been focused upon the impact of climate change and the increasing frequency and severity of natural disasters, including pandemics. And these things are all happening around the world at the same time. And as we invest, and I think we need to think about the dollars that are required to do this as an investment, as we invest in better preparation, better resiliency, we actually, the return on that investment will be significant for all of us. But I think it's also important, and this is in response to the comments that have been made, that as we make those investments, we have to do it from a perspective of a whole of society response, acknowledging and recognizing the vulnerabilities that do exist in our society. And I also wanted to echo my friend from South Africa's comment about how important it is to actually listen, not just to recognize and treat fairly those who are vulnerable, but to engage with them in an appropriate way. And one of the lessons we have learned with our Indigenous population, incorporating Indigenous traditional knowledge into our response, there's a wisdom in that. And it helps us be smarter and better in our response. It's not just the right thing to do, it's the best thing to do. And I think that if we're going to make those significant investments that are going to be required in resiliency and better preparation, the framework provided by the Sendai framework, the global collaboration and cooperation, the opportunity to learn from each other is so critical, and engaging with whole of society is the right way to make that response. Thank you.
Thank you, Minister Blair. I just want to encourage people to start posting again your question as we head to the end of the rounds here. I have more questions, of course, if you don't have. I think Minister Blair mentioned two different points. The whole society approach, but also maybe we should change the way we look at indicators. Instead of like how many people we save, it's like how many disasters didn't happen because we did a good job. And as we usually said, you'll have a lot of crises, you will have a lot of climate change, outbreak, but all of them don't need to be a big disasters. And it's up to us to actually work on that. And I think this brings me back to you. Mr. Jagan, you really mentioned initially the community, the inequity. How can we address identified challenges that the whole panel actually raised eloquently and accelerate progress in managing the new and multiple type of hazard and disaster risk reduction, including in the Sendai framework? How do we do that? Thank you.
Thank you so much. As we see at the global level, I think there are multiple hazards now. I like to talk about 3 C's I call now: the COVID-19, the climate, and the conflict. These 3 big C's coming together and impacting many parts of the world. Of course, there are multiple things we could look into. Of course, our preparedness, as ministers talked about so eloquently. I think these have to be multi-hazard preparedness, because the community are impacted by multiple hazards at the same time. We need to invest on the anticipatory action as highlighted earlier, and we have to build the multi-sectoral partnerships. But to do all that, we can learn a big deal. We can learn a big deal from the communities. And that's where the concept of localization comes into play. A lot of times, these divisions of health versus disasters versus this crisis versus that crisis comes from these big events. In Bali and Geneva and New York, we actually put the crisis into silos. And that means we develop parallel and very expensive mechanisms to actually prepare for and to respond to. And we actually lose a lot of money and resources by creating these silos. But if we change that perspective from the globe or even the capitals to communities, the communities have needs. They don't put them as a humanitarian need, climate need, health need, disaster needs, the buckets we created. The communities have needs. They have aspirations. They have rights. So if we can just flip our thinking from the big capitals to the communities, we can come to a multi-hazard preparedness and multi-hazard response that avoids duplications but builds synergies and partnerships. So let's focus on the communities, let's focus at the local level, let's invest there. That's the best way to deal with this multiple crisis. Thank you.
Thank you. I think you raise a good point about our system, who is actually silo. How do we look at the multi-sector approach in everything we do? But more important, local first, and national and global as needed. But how do we, as the Minister Blair mentioned, listen to the community and not just listen and hearing, but listening and taking input from them, because actually we'll learn so much by looking at our engineers. One of the questions that come from the public is about, okay, now we're talking about COVID-19. The next time will not be COVID-19, it will be something different. We don't know. Biological things, other crises. How do we prepare for something that is not COVID-19? And how do we want to look at that? Minister Tembi, I want to start with you.
Well, I think it's actually what all the panelists have said. Unfortunately, with disaster, you'll never know what will strike. And my colleague here has just said we're actually facing multi-hazards in whatever form. We could be talking COVID in a health form, but you need preparedness in all its entirety. So it means our institutional systems, both political, administrative, collaborative, participatory, whatever you want to call them, have to be all-inclusive. Anticipate what the climate might throw at you. Put early warning systems, for example. Anticipate what the health world needs to do. So which means as countries, we need to strongly invest in our research and development. Bring in the academics from all various aspects of expertise, be it the weather conditions or the health or any other. Think about agricultural hazards as well, which may threaten food security elements outside any other. So we've got to be alive and on our toes and ensure that each and every aspect of life where disaster could strike, we're prepared. Because you cannot anticipate what will happen tomorrow. So there's nothing that I think we need to try and do except to harness the knowledge, exchange the views, and all aspects to make sure that we become like the roots of the tree. We must be all over, have tentacles all over, otherwise you don't know what will strike.
Thank you, Minister Tembi. I think you raised something. I really like trees, and I think that you can either have a landscape of different trees, or you can have a forest. And it's a different, the forest, that means that it's an interconnectedness of the world and how everybody play a role in that. And I think maybe I want to turn to Minister Blair. One of the things we are thinking these days is about pandemic preparedness. How do we prepare for the next pandemic? But how do we look at it in the sense of coordinated trust area? We just saw when the crisis started, or even in the middle with Omicron, when South Africa was the first one to be open and help us, the border was closed. Then how do we actually create a world with a more coordinated trust, and for all of us to be able to respect border, but also be a more whole society, more world?
Thank you. It's a very important question. In my experience, trust is the most important currency of our response. in that our citizens have to trust the information that's being provided to them. And what has been revealed during the pandemic is fairly significant social division and disagreement over the sources of information. And I think it's something for us to reflect on. I'd also make the observation that the first response to any disaster is not our institutions, it's our citizens. The citizens, and I think that highlights the importance of early warning. But just simply providing early warning of an impending disaster is not sufficient. We've actually got to give our citizens, we have to empower them with information and with knowledge on how to keep themselves safe and how to protect themselves and how to mitigate the impact of the potential risk of a disaster. That type of information, and if it is from a trusted source, and this is so important, that if our citizens trust the information that they're being provided, they will take steps to make them less vulnerable to risk. And I think it's one of the lessons we have learned in the pandemic of how important it is to give information in a trusted format, often from our health professionals, in order to allow people to make well-informed decisions in order to protect themselves.
Thank you, Minister Blair. Patima, I'll come back to you. We talk about trust and listening to our citizens and listening to the voice of being the more marginalized and people that usually we don't listen to. How do we think we'll bring that trust? How do you think that the indigenous marginalized can trust the system, because it was the most big issues with the COVID-19? Thank you.
Thank you. The first thing that I want to highlight when it comes to listening to the marginalized groups, I would say respect, being sensitive to their distinct needs, and also listening to the distinct challenges that they face during the emergency. As I've already mentioned, that the COVID has really brought a distinct, unique challenges for the most marginalized groups. And that varies from one individual to another individual. So, co-creating spaces, and those spaces should be enabling, those spaces should be accessible, those spaces should be inclusive, in a very resilient environment is very crucial. We have to listen those stories, the challenges, but also the stories and the challenges also being resilient reflect the way forward, and which is crucial.
Thank you, Patima. I think you raised a big question about listening, but also engaging. And I think I want to come back to you, Jagan, as the NRL Federation of Red Cross, where you have all society in multiple continents. How do we get to a coordinated, trusted approach globally?
You are absolutely right. The coordination becomes extremely important. But let me share with you your first question to Minister Thembi. A lot of the crises, the principles are exactly the same. The principle of response is basically the same. If you have built an infrastructure, and if you have built the legal frameworks and policies, and the coordination mechanism, actually same can be applied to different crises. Of course, you will have to tweak 5 to 10%. But 85 to 90%, you can actually prepare. And part of that preparedness is a coordination mechanism. There is a coordination mechanism at the international level. And I think during the COVID-19, we saw the coordination among the science was excellent. There was the sharing of the information and the knowledge, and it worked very, very well. But the coordination of other things was not as great, just even in European Union, the same European Union, the one vaccine doesn't work to the other countries. Right now, just a few weeks ago, just Geneva and France, we didn't have to wear the mask in Geneva. You put in the same bus across the border, you had to put the mask. I mean, it simply doesn't make sense. So the intergovernmental coordination, interagency coordination becomes extremely important. But the most important becomes the coordination at the country level. I think in the International Federation, we do have a system of coordinating the internationally 192 national societies. That's what my office as a secretariat plays that central role of coordination. And we are also putting that coordination level at the coordination level, which promotes peer-to-peer support, because there is a growing capacity at the national level, and it's very important that we capitalize and benefit from peer-to-peer support. So preparing and making coordination as part of the preparation is critical to respond to different type of crisis, the crisis we don't know yet.
Thank you. I think this is, we come back to again the same thing: coordination, listening, and trust. And I think this is bring me back to all the panelists for final words. I'll give you 1 to 2 minutes to what did you learn and what do we take away from this conversation. I'll start with you, Minister Blair.
I think perhaps the best lesson that shared from this panel is the importance of our global cooperation and collaboration, working together, learning from each other. I think all share the same goals of protecting our citizens, investing in adaptation and prosperity. I think it's very important that we acknowledge and recognize those who are most vulnerable, and that we engage with them in a very respectful dialogue to ensure that their needs are met and recognized, and that we engage more fulsomely with them. I think there are many opportunities that have been revealed through the pandemic for us to improve our global response to natural disasters, and I think it's only by working together that we can be truly successful in keeping all of our citizens safe.
Thank you. Minister Tembi, over to you, last word.
Readiness is key. I think those are my last tweets. After all is said and done, we have to be ready for the next, whatever it is. Plan for it.
Thank you so much. Over to you, Patima, your last words.
Policy to practice, ambition, because we are very much ambition with the COVID pandemic and related with those things. So ambitions to actions. I would also say when it comes to marginalized groups, the evidence-based advocacy is very much crucial by their meaningful engagement. Community leaders' roles and the CSO's roles working together with the government and multi-stakeholders is very much crucial, putting them in the center. Thank you.
So much. Over to you, Jagan.
Thank you. I will share 2 points, if you allow me.
Even 3 if you want. It's okay.
The first one, I remember this quote that said, the plan without action is daydream.
Oh, yes.
And action without plan is a nightmare. So I think we really have to combine our planning and our action and get the right balance. I think at the global level, we have too much planning and very little action. And too much analysis, sometimes we have, analysis paralysis. So I think combining the planning, analysis, and action and getting the right balance extremely important. My message here also is we have 2 ministers on the panel, and I'm sure we have a very distinguished guest in the audience. It's one of the lessons learned from the COVID-19, and of course, as we respond to the climate crisis. I would like to make one request, and that request is, let's move away from the terminology of build back better. For me, that is not good enough. Build back means it puts us back. That back was the one which brought us here. 6 million people dead. So I would like to propose that let's think of building forward better, because that puts us in a new paradigm. So let's look what is the potential of the current world, current capacity, so that we can position. When we rebuild looking the future, not the past. Because the past limits our ambition, and past limits our opportunities. So that will be my request and call. So let's build forward better. Thank you.
Thank you to all the panelists. As you see, we can continue the conversation, but I'll take a few points here. The first thing is that as we learned from COVID, that is still ongoing, is that we should use this opportunity to reflect, but actually to look at the whole society approach. This will be an important. How do we prepare for the next big crisis by using the small crisis? How do we listen better to our citizens? How do we create an environment of trust, togetherness, and working together? And more important, how do we make sure that it's part of our law, but also part of our action? Because we know that without action, without action, the plans are really beautiful, but not. But more important, how do we finance it? How do we make sure that as government, first responsible for country, we take it seriously to put money where it matters. But we also, that money is not just about government to be used, but it's also engaging early on all the society, the most vulnerable, more important, and actually build on what you have. The system have to start with, especially there's a lot of richness in indigenous society, marginalized. I usually say, if somebody coming to my grandmother, she was poor, but if somebody is innovative and know how to deal with crisis, it's them. Because every day can be a crisis, but they actually turn it in opportunity. And I think this is our message. Crisis and COVID-19 should bring us forward and to change the way we think about it. Because unless everybody is safe, nobody is safe. My neighbor depends on me, I depend on my neighbor. And coming back to the trees, the interconnectiveness of our society, of our world, our global world, is so interconnected that we can't function with closed borders. Everything in our society now depends on each other, from economic, from health, from society, from everything. We are one world, and unless we look at it that way, we will not progress. And COVID, as a crisis, presents us an opportunity, and I love what jargon means, and I will use it now: build forward better, stronger, and safer. Because if we don't do that, we'll not go. And one of the proverbs that I like to use from my African continent is that if you want to go fast, go alone. And if you want to go far, get together. Then my call for everybody here is like, how do we become a coordinated global world with specificity at the local level, but bring everybody together, because only then we'll be all safe and we can go in a more healthy and productive life for everybody. Thank you. Thank you. The next session will start in 3 minutes. Then it gives us all the session for ministers to go and take some break, some coffee, some water to lead the next session. Thank you, everybody, for listening. I hope we will get out with something else. Thank you.